All right, guys, what we're going to be talking about for this portion are pages 4 through 8. Just a little quick review. This PowerPoint slide talks about units of measurement. Honestly, probably the only one you need to worry about is the millimeters of mercury to centimeters of water pressure. Centimeters is bigger than millimeters, so 1.36 centimeters of water pressure for every millimeter of mercury. Honestly, probably will not use this measurement in the real world. However, I have seen an NBRC question asking about this. And whenever we talk about hemodynamics, which is blood pressure in the heart, you'll have to know what the blood pressure is in millimeters of mercury and centimeters of water pressure. But we'll talk about that later. This PowerPoint is taken from page 4 in your books, as you can see. What this is telling you is how much pressure is needed to get air from the airway opening, aka the mouth, all the way down to the alveoli. If somebody's got low compliance, meaning their lungs are stiff, maybe they have something called ARDS, which results in really stiff lungs, they don't move at all, which means it's really hard to get air into the lungs, you might need more pressure at the mouth to get air all the way down to the alveoli. So when you have a person on a ventilator and they have that endotracheal tube in their mouth, you're going to have to use more pressure to get through that tube through the alveoli. If somebody has normal compliance, meaning normal lungs, their lungs move nice and easy the way they're supposed to, then it won't take as much pressure. This PowerPoint comes from page 5 in your book. I'm going to show you a video in class, and we may do some exercises to help this make sense to you. But what I want you to get from this is that on the left-hand side, what we're looking at is the inspiration, and on the right-hand side, we're looking at pressures of expiration. The most important thing I want you to get from this picture is that the intrapleural pressure is always negative. It's either -5 to -10. It's never positive. It has to remain negative because that negative pressure literally pulls the lungs out. It keeps the lungs open with that negative pressure. If a patient were to have something called a pneumothorax, which is a hole in the lung, which can happen, let's say somebody gets a gunshot when they get shot in the chest, there's a hole that goes from the outside to the lungs. That pressure now is positive, and that positive pressure would actually collapse the lung. So it has to be negative to suck all the air out and keep the lungs open. The last few slides of this session are dealing with compliance and resistance. As I've mentioned before, compliance is how easy the lungs move, and resistance is how much stuff is in the airways that keeps the flow from getting to the alveoli. We're going to be working on compliance and resistance for the next 4 months. Some students pick it up right away. Some students have a really hard time grasping these concepts. So if you feel like you're getting frustrated because you don't understand compliance and resistance after reading these few pages in the book and after listening to this, that's okay. We're going to go over it and over and over it until everybody gets it. In short, compliance is how easily the lungs move. The equation is change in volume over change in pressure. What that means is how much volume do you have to give a patient to get enough pressure to open the alveoli. That's all we're looking at. But again, we'll do some of these exercises in class. The last 2 slides deal with airway resistance, and again, this information comes straight from your book. Airway resistance basically means there's some stuff in the airways that make it hard to get the flow to the alveoli. Let's say a patient has a bunch of mucus and stuff in their airways. It's really hard to get the air through that. Let's say somebody choked on a peanut, which happens a lot with kiddos. Let's say that there's a peanut in the airway. Obviously, it's going to be really hard to get airflow down to those alveoli because the airway is obstructed. So these are some of the things that we look at. As you go through your diseases course, you will also understand diseases that increase airway resistance. Again, this is something that we're going to be talking about for the next 4 months. So if you don't get it after today, don't get frustrated. Just keep going and we'll get it so that you understand.